What we found with Wiley Protocol is that we were curing one part of the couple, and invariably the other part of the couple would come in, or the wife would say, "Gee, my husband's sitting like a cat on the windowsill doing nothing," or vice versa. And so we thought, gee, we need to address both. And we initially started out with the individual, and now we're doing dual counseling in some cases with couples. And you can't fix one partner without the other partner, and her protocol is really that good that it's a problem if we don't address both. And so that's how we've kind of decided to deal with this.
And the Wiley Protocol does do a good job of having men's protocols as well as women's protocols, so it lends itself into couples therapies very nicely. We've both been physicians for 25, so we have familiarity with hormones and bioidenticals, but the couples part of the practice is that's 5 to 10 years, and it's so rewarding. It's just nice to have a couple come in and they're just run down, they're not thinking clearly, they're not sleeping well, and you get them balanced with a T.S. Wiley type protocol, and they just respond so well. They're just so grateful.
Typically, one partner will drag in the other partner. Oftentimes somebody will say, "Oh, this is hogwash, I'm not going to do it." And when the partner sees the other partner, "My goodness, I'm living with somebody 20 years younger than me. All of a sudden, I want to be like that." And the other one just automatically comes. There's no pulling in. It just happens, and it got to the point where it was happening so much that we decided this is the best way to address that.
We're seeing more and more, word of mouth spreads, the couples are happy, they're talking to their friends, they come in, and they say this is what you have to do. Because remember that most of these patients are of similar age groups. So if they're 50 or if they're 60, if they're 45, they're going to have similar age friends. And they can say, well, I can see you're not sleeping, you don't have that zest, you're not working out as well, you don't have the energy recovery. Go and see Dr. Giroux, see Dr. Barrett, and go in together, go in as a couple.
There's no question that it's a lot easier to do whatever you're doing if you have a buddy or a partner or a workout partner, whatever you want to call it. So oftentimes it'll be the wife who may say, "Hey, did you remember to take your medicine today?" or vice versa, or if you have a husband who will go to the pharmacy and pick it up, or whatever. Everything is always better when you have a partner, and we find that certainly partners therapy works with Alcoholics Anonymous, with dieting, with exercise, and we found that this partner routine works very, very well. The protocol is a very simple protocol to follow, but if you have somebody on it with you, and as Dr. Giroux says, this is something for both men and women. So why correct one and then have the other one be like a snorting bull at home?
We find that if we have an individual that comes in, they don't have a partner, say a woman or a man, they may find a partner relatively soon, then they bring a partner in.
Benefits as a couple is certainly excellent. Certainly better sleep patterns. I had one couple, and she was up all night with the light on, reading her books and having hot flashes and going to the bathroom every 2 minutes, and that marriage was about ready to break up because he couldn't get any sleep. That would certainly be one benefit, sleep pattern, just alone.
And I think, as T.S. Wiley points out, the protocol is easy to understand. However, if you have somebody in the same house using the same protocol, it makes it even easier. It's easier to follow. The better you follow the protocols, the better off you're going to feel.
And certainly, as we've touched on, the libido, it doesn't help to correct one part of the couple if the other one is not corrected. It just causes frustration. And so it's been a team effort, and we all know that teams always work better than just one.
And we find that the couples like, if it's a male and a female come in, they also like having a male and female that they can talk with. It's easier to talk with people, to chat with them.
A female may not want to tell him that she's having some particular female problem, such as breast tenderness. But if I'm sitting in the room, it makes it a little more socially acceptable, or vice versa. A male may not want to tell me that he can't get it up anymore. I'm sitting in the room, makes it a little easier.